Hi, I'm Hilary Talbot, acupuncture physician and clinical herbalist. Today we will be discussing acupressure for tinnitus, or sometimes called tinnitus. Now, tinnitus is one of the most difficult conditions to treat in Western and Eastern medicine. And once you have it, it can actually become quite debilitating and cause things like depression and anxiety because it's quite unsettling to have this buzzing in your ear. When you go to visit the acupuncture physician, they will often ask you questions about the nature of the sound. Is it high-pitched? Is it low-pitched? Does it sound like cicadas or water? And that helps us differentiate which organs are kind of at the root cause of this disharmony to better treat you. So 2 points that are actually used in the symptoms treatment of tinnitus are gallbladder 20. Gallbladder 20 is located on the base of the skull, just behind the mastoid process. The mastoid process is this like little bony protuberance that comes out of the base of the skull here on the lateral side on each side of the neck. And your finger kind of just falls into a divot, and it'll often be quite tender. And you want to use kind of moderate to firm pressure on these, and sometimes people will actually use their thumb too so that they can get quite a bit of pressure in these areas. I would recommend that you press on these points for about 30 seconds to 1 minute, about 10 times a day. And so this can be done very inconspicuously while you're sitting at a meeting or you're having dinner, and nobody has to know that you're doing it. And while it may not stop the tinnitus, it will actually slow down the frequency and the intensity of it over time if you do this multiple times a day. The other point that is quite helpful, that is often needled when you seek treatment for tinnitus, is right here on the outside of the ear. And there's also a hollow here. And if you open and close your mouth when you're pressing on this point, you can feel the jawbone open up, and that really allows you to get in a little bit deeper into this point. And this can also help with the frequency intensity of tinnitus. So as I said before, it's really important to understand the underlying patterns of disharmony. So I encourage you to seek out your local acupuncture physician for proper diagnosis and points that are specific to you. I'm Hilary Talbot, and that was Acupressure for Tinnitus.